If you consider the human body and all of the systems we have in place to have it run smoothly, when we break down all of the systems critical to the high functioning of each one, if something breaks down, exercise is almost always cited as the most impactful form of care that one could be exposed to.
Hello, my name is Cecilia, and this is Pilot Projects, Stories from the Jefferson Trust. I've always had a touchy left knee, even though I've never had a major injury. Years of horseback riding, yoga, hiking, and off and on strength training just built up to where I needed months of physical therapy to properly strengthen my muscles and get back to doing my favorite activities with minimal pain. But not everyone can access that much physical therapy or one-on-one exercise coaching. That's where the Freed Center for the Advancement of Potential, or FCAP, at the University of Virginia comes in. FCAP is attempting to bridge the gap of access to one-on-one physical therapy and exercise coaching for UVA faculty, staff, and students, as well as intellectually and developmentally disabled residents of Innisfree Village, a residential community of adults with intellectual disabilities outside of Charlottesville, Virginia. Keila Strick, Jenny Turner, and Micha Nenbee sat down with Sound on Ground's producer Sarah Bastianelli to discuss their Jefferson Trust-funded grant project. I'll let them introduce themselves.
My name is Keila Strick, and my role at the university is Co-Clinical Director of the Freed Center for the Advancement of Potential, otherwise known as the Freed Center, or FCAP, at UVA Student Health and Wellness. I also teach and instruct a course within the kinesiology department called Service Learning in Medical Fitness. I'm also an alumni of the university and the internship program, class of 2017.
Hi, my name is Jenny Turner. I am a student. I'll be a fourth year this year. I am one of the interns or medical fitness professionals at FCAP.
My name is Micha Nenbee, and I am currently a fourth year at the University of Virginia, majoring in kinesiology and economics. And I am a student intern at the Freed Center, or FCAP.
Our program started in 2016 at a clinic adjacent to Innisfree Village, which is a community for adults with intellectual and developmental disabilities. It's 30 minutes west of Charlottesville and Crozet. And it was really our proof of concept for the clinical model that we opened up at UVA Student Health and Wellness at the end of 2023. So our project is a functional exercise clinic that is student-led. So we have a student-led model that allows for affordable access to one-on-one exercise-based care for all health-related purposes. I like to describe it as offering one-on-one exercise intervention for something that wouldn't otherwise be covered in the health insurance-based model. We, at the Freed Center, we see clients that are primarily UVA students, both grad students and undergrads. And recently, as of the late spring of 2025, we expanded our services to UVA faculty and staff. And we have specific hours designated for those clients, but we're really excited that we can now provide care to basically all of the university and everyone affiliated. We treat for the purpose of someone being prescribed exercise that maybe otherwise wouldn't be covered in an insurance-based model. So that could be chronic injury rehabilitation. Maybe they're discharged from physical therapy. In the case of like ACL reconstruction, for example, many people are limited to their appointments, and it's pretty well understood in the literature that 9 to 12 months of therapy would be ideal. In the case of injury prevention, so absent of an injury, club sport athletes, for example, or weekend warriors, UVA rec athletes can come in if they're fearful of injury. Exercise education, people wanting to learn about how to implement their own programming, and also like mental well-being and, like we said, anything health and wellness related. Something that's really important when we think about students coming in as clients is not just what they'll learn during their sessions at the Freed Center, but hopefully what they take with them throughout their lifetime. So we prioritize education a lot in our approach. And I think so far we've had a lot of positive feedback on that front.
The main premise of FCAP is functional exercise. So like working muscles that you use on a day-to-day basis. I think a lot of us, when we go to the gym, we're like lifting heavy weights and we're doing a lot of two-leg exercises, where I think a lot of things with FCAP work on single leg exercises where it's like we're walking on one leg. So it's things that you'll use on a day-to-day basis rather than just like being able to lift heavy weights.
Is there any specific patient or case that you remember like being difficult and learning a lot from?
Actually, yesterday, we had a patient come in who had experienced a lot of back pain due to a job that they had had when they were a lot younger, where they had to lift heavy weights pretty often and like walk pretty often with these heavy weights on their back. And they also climbed a lot and like had a pretty active life. But then during one of their hiking experiences, they twisted their back. And from that moment, they had back pain to the point where he said all the time he feels a 7 out of 10 with back pain, whether he does anything. That was about 20 years ago. And so he's been experiencing this pain for a pretty long time. And it was just super interesting to see how he definitely had nerve damage with that injury when he was younger. And so from that, it had just gotten worse, and it had gone from not only back pain, but then to that pain radiating down to his leg, down to his shin, down to even his Achilles. So just like seeing how that pain radiated and how just that like small tweak in your back can affect how your whole body works was crazy to me. I just thought that case was super interesting just because I don't think I've seen an injury to that extent, I guess, because he had not only experienced like a disc bulge, but he had like a full tear in his disc, leading to just a lot of nerve impingement.
The two main people who started the FCAP model are David Ludica and Barbara Freed. So David Ludica is the founding clinical director of FCAP or the Freed Center. And he is a physical therapist and strength and conditioning specialist who really has executed this functional exercise model. David was the visionary behind incorporating students into the clinical model, where he and Barbara Freed reached out to Marty Block, who's one of the professors of the kinesiology program, to access kinesiology undergrad students who were seeking clinical hands-on hours to then apply to their respective graduate programs. And he is also the person who, recognized that the intellectually disabled population, if the CDC guidelines say you need 150 minutes of exercise with 2 days of resistance training per week, he recognized that this population in particular will always require one-on-one care, and therefore the standard model of care would never suit this population. And Barbara Freed, she's our benefactor. Her son, Jonathan Freed, is really the inspiration of FCAP. He has an intellectual disability and is also a Special Olympics tennis world champion, two-time gold medalist. But exercise was so important in his life, and she wanted that to be accessible to the community at Innisfree, which Jonathan lives in as a full-time resident. And when she saw this model play out at FCAP, she served on the board of visitors at UVA for 2 terms, and her parting gift was to build out this Freed Center at Student Health and Wellness. She's really all for the student experience, so students could also see for themselves this form of care. Barbara Freed is one of the most generous, selfless, kind-hearted humans that I know, or in all of our lives. And she really thought it was important to offer this service to the UVA student body.
We asked Jenny and Keila how the services FCAP provides are different from more traditional physical therapy or personal training services.
Here at FCAP, we do more of a holistic kind of stance with it. So you'll come in for your eval. Let's say you come with your knees hurt. We don't really care that your knee hurts. Well, we do. But we more so care, why does it hurt? We're trying to find the root problem with it. And so we really start with a holistic full body, kind of like looking at the feet, because if you're having a knee issue, it could be stemming from the foot, from the hip. So we really try and look at all angles to see how can we solve that problem. And then after the eval, it's more handed off to the students then. They then start working, like writing the workout plans, And all of them are individualized for every person that comes through. So no plan is going to be the exact same for anyone that does come through, even if it could be possibly the same issue. We still have special things for every person.
Specifically, like, it's not just the focal injury that we're focused on. It's really understanding from a biomechanical and structural standpoint, why has that injury occurred in the first place? And then treating the whole body in a way that we put education at the forefront. So all of our clients hopefully have the tools to not only maintain their rehab for current injury, but also understand some of the guiding principles throughout their lifetime to prevent future injury. If I were to explain our approach in more simplistic terms, I would say, and I always say this, I'm a physical therapist and a strength and conditioning specialist, but how we practice is really a marriage of the two. So I don't think I work in a standard PT model. When a personal trainer might otherwise understand that someone has an injury and work around it, we work with the injury. And that's something that I've taken from our mentor, David. And he always says that, and I think it's like a really good way of describing it. We kind of call it or refer to it internally as the medical fitness model. So taking a very medical lens to exercise intervention. And then I'll like build off of something that Jenny was just alluding to. Our clinic really operates in a collaborative care model. So what you might see in a standard outpatient setting where physical therapists have their own patient caseload, we share the patients or clients in our case under this exercise model where the physical therapists are always involved in the evaluation. And then for each follow-up session with the students coming in, talk to the student interns about the plan of care. And one physical therapist is on the floor supervising the implementation of the exercise sessions, while another physical therapist might be in an exam room evaluating new clients coming in.
What is the main difference between the Crozet location and the student health location?
So the Crozet location is located in Innisfree Village, which is a living community for adults with intellectual disabilities. And so they are out there just living their daily lives. And so FCAP is almost one of their workstations. So they have a couple different things that they'll do throughout the day. Like if that's like wood shop, weavery, bakery, kitchen, FCAP is one of them. It's kind of their gym time. So they'll come out for about an hour and a half block, do their exercises, all that good stuff. Most of them come out, I'd say, 2 times per week. So it's really good for the interns, like when we're like out there at the farm that we're there often. So we know how to like interact with them, how like what things they like to talk about, just like it's a good time. And then at the clinic here at UVA, it's just you're in the student health and wellness building, you're seeing students, faculty, all that good stuff. It's definitely different working with people with intellectual disabilities, but I am very grateful to be in my position to have the chance to work with them. They are some of the most hard-working individuals I have ever worked with.
Our long-term goal is also to incorporate or offer our services to community members in Charlottesville and maybe work with Special Olympics in Charlottesville to have like personal training or exercise services for adults or individuals with disabilities. I think there's something to be said about sometimes working with children or seeing the world through like a child's eyes again, where it's before there's like you're impacted by societal norms or before you feel the need to conform. It's just completely unfiltered and the conversations are wholehearted and genuine, and there's never a time where you're like questioning the lens of their approach, because there's like this kind of innocence that is really like it's a life lesson every time you get to interact with that population, and it's wildly refreshing.
I could be having the worst day in my entire life, but if I know I get to go out to the Crozet clinic, my day like turns around completely, like a full 180. I know I'm like, I get to go out there. I get to work with the people. I know it almost feels like a family out there just because we've been working with them for so long. And I just be my crazy self. Like I like to say, I'm kind of crazy, a little weird. And sometimes I'm like, oh, I got to act all professional, and which I still do, of course. But it's like you get to have fun with it. You get to play around with them because you just get to work with them so often. You'll know their little like quirks and like tricks where it's like, oh, well, like let's go have fun, like and do like this certain exercise. Like let's do a bonus. Like there's so many amazing things. And also it just teaches you patience as well, because sometimes they might not quite understand an exercise or the form initially. And that's okay. Like, you just have to reroute and be adaptable and work with them and figure out what works for them and what doesn't. I remember literally yesterday at work, I took this little like stand and I had to put it underneath them for like a depth cue for a squat. And it worked great. I've always seen it sitting in the corner of like the gym and I'm like, never used it before. And I'm like, well, maybe we can play around with that. So learning how to be adaptable and just literally every life skill that you have that can be improved, it gets improved over there.
Right. Yeah. There's definitely institutional knowledge at that clinic where you not only learn what's important for their physical health, but you understand the idiosyncrasies of each client coming in. And, Jenny can tell the new intern class that, hey, so and so doesn't respond to tactile cues. And actually, it really freaks him out. So when you cue him, make sure like you look at him in the face, you stand 3 feet away, and, just like little tips and tricks like that go a long way serving that population. From a provider standpoint, this population oftentimes have language barriers, whether it be like, level of intellectual function or communication barriers. It requires you to be a detective in understanding movement and biomechanics. And it also gives you an opportunity to work with this diverse population. And both of those skills are crucial to take forward into a profession in healthcare.
We asked why it was so important to provide FCAP services outside of the health insurance system.
If you consider the human body and all of the systems we have in place to have it run smoothly, when we break down all of the systems critical to the high functioning of each one, if something breaks down, exercise is almost always cited as the most impactful form of care that one could be exposed to. And still, our country doesn't really support modes of one-on-one exercise intervention that is affordable. So the average price for a personal trainer is somewhere between, 70 on the low end and 150, 200 on the high end for a high-level personal trainer, and for an hour session. And for physical therapy, cash-based models typically charge anywhere between 100 and 250 per hour-long session. Even insurance-based models for physical therapy have a copay that can range between $30 to $80 per session. So we have funding options for students through the Cavalier Fund, and we're trying to expand our funding options. And, we have a fixed rate of $40 per session, regardless of initial eval, regardless of follow-up visit, to allow for continued access to care. For the intellectually and developmentally disabled population, we have a reduced cost to that charge as well.
I think it's also just important to have the non-insurance space because I know as a college student, sometimes things can get pretty pricey personally. I've actually referred a couple friends out to the center itself or like to the clinic itself. And they're like, this is so much better because I used to like go to the trainers. Like it just used to be so much more expense. And sometimes, especially as students, we don't have the funds all the time to support that.
This is a quote. I'm going to keep quoting David, I suppose. If exercise were a pill, it would be the most widely prescribed medicine in the world. And despite knowing that, many people don't really know where to start when it comes to one-on-one care for exercise prescription. And it's not currently covered in our insurance-based model. So that's why it's really important for us to offer kind of a continuum of care between physical therapy and personal training or just gym membership.
What got you interested in this field, and why have you stuck with UVA this long?
Well, I knew I wanted to be a physical therapist pretty early on in my high school career from an injury. When I came to UVA, as part of the kinesiology major, we have to do practical hands-on hours. I did one at a standard clinic in town, but through a classmate, I heard of an opportunity to work with adults with special needs in an exercise-based model. And I've had experience with this population in particular previously, so it really appealed to me, and I was pretty blown away with the internship experience. 2016 was the year I joined the internship, and it was far and away the most valuable hands-on experience I had and the best mentorship I had. Our mentor and boss, David Ludica, the founding director, had a really unique and outside the box approach to physical care. And through partnering with kinesiology, we were able to offer, through student workers, we were able to offer affordable lifelong care for the residents of Innisfree Village. And I think my intern class was 6 students, and now we're averaging, somewhere between 22 and 30 per intern class, operating, 9 years later. When I graduated and took a gap year at FCAP, I then went to grad school in California and had various clinical rotations in really, cutting edge and cool outpatient ortho clinics, which is the setting I wanted to be in. And I couldn't stop thinking about my internship from undergrad, or the quality of care that we are able to offer, the hour-long appointments, the flexibility and freedom to be like creative with our approaches, and working with students in this model. And I think it was a no-brainer for me to, when I knew of the opportunity to come back for a full-time position and to help expand to this second clinic, which is a big reason why I came back. There's no other opportunity like this.
We also asked Jenny how she got into kinesiology and into the FCAP internship program.
So I actually came to UVA as an attending bio major, and I came in that first year. I took a couple random classes. I was like, man, I kind of hate this. So then I kind of had a reroute semester. I was like, what do I really want to do in my life? And back in high school, I thought about physical therapy, and then I was like, maybe let's kind of give that another viewpoint. And then I eventually transferred to kinesiology in the spring semester of my first year, and I fell in love with it all my second year. And then, very thankfully, I found out about this class. So I applied for it. I was able to take it in the spring semester. So I've been involved with FCAP since my second semester, second year. I'm kind of an old head at this point, it feels like. But it's been the best experience at all, because I've shadowed traditional PT clinics, and I thought that was great. But this just has amplified it by 100%. I could never imagine going back to a clinical setting. There's just so much that I've gotten out of it so far. One, the mentorship, kind of like Keila mentioned earlier, I feel like I'm learning a new thing every single day I go into work. And it's how do you really do that? But it's so true in this setting. You get to work with amazing people, the students, the faculty out at Innisfree with all the adults with intellectual disability. You really just become a better person every day you get to go to work. And I'm always so excited to go. It's almost like when people are like, oh, you have to go to work. I'm like, no, I get to go to work and work with all these amazing people and just see them get better over time. It's the best. I have a client this morning. I've been with her for probably almost 7 months now. And it's amazing just to see the progression. And I know I'll be here for my whole 4th year, and then I'll be planning to take a gap year, and I'll be living out at the farm. So I'm very excited to be here for 2-ish more years.
We asked about the process of becoming an FCAP intern and how the internship itself works.
So basically, you start by taking a semester-long class. It's a prereq course for medical fitness and all that good stuff, really talking about the true depths and our theories behind what we do. And then during that course, you're also required to shadow 2 hours in the clinic. The first half of the semester will be at the Crozet clinic. The other half will be at the UVA Student Health one. And then once you finish the class and accept the internship position, you will then be a training/shadowing intern. So you're paired up with other interns who are already independent, and you're just kind of watching them, seeing how they cue exercises. You're then being taught, let's say for one block, you'll be doing exercise lists. So you're going through everything, making sure you know how to cue, what's targeting properly. And then progressively over the next couple of weeks, you then help start writing the plans. So let's say you're with the older intern, they write the first half, you write the second half, and then they'll usually lead the first set of exercises, and then you'll lead the second set. It's a gradual progression of you taking over the session more and more. And then at the very end, you're basically leading the session, and the older intern is actually shadowing you, just making sure that you're doing proper form, taking account of safety, that you're really just being overall well-rounded. And once you get to that point, you become an independent intern. I think just from an education standpoint, this has been the most prominent thing I've done in my college career. I feel like I've learned the most in this setting. Don't get me wrong, all my classes are amazing. I've learned a lot through them, but I've actually been able to apply it here, and I can see where I'm going with my future with this class.
Yeah, I think the training process that Jenny just described, the beauty in the actual training once you finish the course is that interns who were so recently in that position now get to be, as Jenny mentioned, the mentors rather than the mentees. And that peer-to-peer training model with supervision from licensed staff is really valuable to reteach the skill set that you had just learned, within the past 6 to 12 months, and solidify that knowledge even further. And then with that foundation, you can just start to learn more and more of like the nuance and intricacies of treatment. One of the biggest impacts I believe we're having at the Freed Center are on the student interns, and 100% of the student interns, we're at 85 alumni, have gone into healthcare professions, and they're carrying forward this mindset of inclusive care. So they have the skill set to work with a diverse population, and also really understand that it's not just about managing something that already exists. It's prioritizing a preventative care model, really prioritizing long-term health outcomes, and finally, just understanding that we can step off the wheel from what is traditional. We can decide to do something different if it feels right to us. And I'm really grateful that that's the route that I took professionally because it feels impactful.
So if somebody is listening, like a UVA faculty or student, and is dealing with a chronic injury and want to access the center, how do they do that?
So they would just access it through Healthy Who's by selecting functional exercise, and they can schedule an appointment through that.
All right. That's all my questions. Thank you so much for joining me.
Yeah, thank you.
Thank you.
Pilot Projects, Stories from the Jefferson Trust, is a Sound on Grounds podcast. Sound on Grounds and all the projects featured in Pilot Projects are sponsored by Jefferson Trust grants. You can find more Sound on Grounds podcasts at virginiaaudio.com/soundongrounds. If you'd like to learn more about FCAP's work, go to fcapotential.org. This podcast was engineered and recorded by Sarah Bastianelli and the Robertson Media Center Audio Studio in Clemens Library. It was written and edited by me, Cecilia Parks. The Pilot Project's show cover was designed by UVA alum Karina Villacci, and all the music you hear in this episode was written and recorded by Jason Evans Groth in the RMC Audio Studio. Many thanks again to Keila, Jenny, and Micha for taking the time to share their project with us.